How do we know what students know? When we visit a doctor, either for preventative care or for an illness or injury, their job is to collect information about certain health indicators and use them as evidence of what we might need. Some indicators are more obvious than others. A skin rash is immediately visible. A broken bone may or may not be visible, but an X-ray and the patient's pain rating gives the necessary clues to determine if a cast is necessary. Cancer may go undetected until it causes other problems. Educational assessment works in a parallel way. Teachers use evidence of learning to determine what students need. The evidence may be more or less obvious depending on the student, what they're learning, and the tools that teachers use to measure that learning. Good teachers know that what students know, understand, and can do changes constantly. So they're always paying attention to evidence of what they have learned and what they're ready to learn next. Evidence includes a complete scope of clues that come from informally watching students work, as well as their performance on formal assessment measures. Evidence must be interpreted by teachers to give it meaning, just like an X-ray must be viewed by a doctor to determine what the patient actually needs. Reading is one of the most complex processes that our brains learn to do. It's relatively easy for teachers to notice a problem in reading development, but that doesn't mean the teacher knows how to pinpoint the cause or the remedy to the specific gap a student has. No matter what the student is learning to do, it takes skill to examine the evidence at a deep enough level to determine what the evidence is suggesting about their needs. Combine it with the teacher's interpretation, provide targeted instruction that moves the student forward, and repeat the cycle so that students' needs are met. There is no perfect assessment tool. If there were, teachers would just be handed a set of assessments to use for each class, grade, or unit they're hired to teach. Sometimes a curriculum publisher does include an assessment plan as part of their materials, but that doesn't guarantee it will be connected to specific goals or aligned well with instruction to give it meaning. And while districts often do and should provide some common assessments in order to collect consistent information and evaluate learning trends, it's still up to teams of teachers to really bring assessment expertise to make it valuable. Solid assessment practices include constantly scrutinizing the methods for collecting evidence of learning to minimize bias and reveal accurate information about what students know. Though there is no perfect tool, the more evidence you have, the more accurate your picture of a student's learning will be. Sometimes the evidence a teacher sees on an assessment contradicts what they believed about the student's skills. When that happens, it's either a problem with the assessment, a problem with the teacher's perception, or a mixture of both. No matter what method is used for collecting evidence of learning, it's always important to return to the overarching purpose. What does the information say about what students know right now, and what do they need next? Methods for collecting evidence of learning include everything from the specific question formats on a quiz, to well-crafted interview questions, to the carefully orchestrated discussions the teacher plans and observes during class. Questions are at the heart of both revealing what students know and determining what instructional steps to take next. The right ones give the teacher great information, and the wrong ones will provide very little valuable information. We know what students know because of evidence. Evidence can be direct or indirect, depending on what is being assessed. Collecting data without interpreting it is worthless and a waste of effort. Teachers' interpretation is what gives meaning to assessment data. And teachers must be willing to confront the reality that their perceptions might be flawed when they contradict with valid data.